Hello, everyone, and welcome to this audio podcast. In this audio podcast, and part of this intermission the in around this intermission, wherein this intermission looks at sort of an overview in around in around research and works that aligns sort of research and works that had taken place between 2017 or 2018 to 2021, and also aligned to research that had been sort of drafted. Excuse me. That has sort of been drafted retrospectively in 2014, and where this sort of audio podcast looks at works in regard to in regard to an outline or overview in context of in context of mentoring, educational support, and inclusion for chronic kidney disease patients or CKD patients, and wherein this works, wherein this wherein the wherein this sort of outline is from a sort of pediatric and adult CKD perspectives, in context of draft in context of a sort of an outline, and this is an audio podcast aligned to the Traadax Fissure. This is a Traadax Rupture and an audio podcast aligned to an intermission an intermission with a Storm Lobostics production. This is another chartered edition, and an evidence-based perspective. In this works, the provision of appropriate educational support and interventions can improve self-care and sort of self-management. There's works by Budsey and team in 2018 and around this. But given the technical advancements, there are also disparities between patients who are motivated to navigate elements of healthcare and those who seek out information but have little desire of becoming self-empowered. Patient education is identified as essential to use, wherein patients become more sort of autonomous surrounding health and disease. Education initiatives help people with long-term conditions or LTCs develop skills and confidence to manage sort of intricate sort of aspects around sort of system around sort of health systems. In works that have been that have highlighted have highlighted or reported sort of a sort of where patients aligned to public health sort of access sort of have preference in context of access to sort of health regarding information, etc. In a survey of 353 people with particular long-term conditions, it was reported that the support is almost sought from health professionals, whereas 76% is around health professionals' websites, websites in around 75%, and friends of family or friends in around 64%. So managing and providing educational support to patients with LTCs, and for example in around chronic kidney disease, CKD, sort of has been in the hands of health service providers, including, for example, nephrologists and specialist nurses. CKD patients are not always aware of diagnosis or armed with informational support owing to disease becoming quickly multifaceted. And there's works by Ahmed and Mendu in 2020 in around this. However, educational support, or education in this context is important is important, forms a basis, because CKD CKD in particular is irreversible, and patients need to be aware need to be of need to be aware of the disease sort of accordingly. And in the case of pediatrics or young people, it is important to involve parents or guardians, so that they are more equipped to provide best practice. As works by Bailey and team in 2018 and around this. And coping has been explored. Coping has been explored in young people, in around young people with chronic kidney disease or CKD, and works by Mohammed and team in 2015. In 2015, have evidence and some context in around this. And around healthcare and inclusion, then, an estimated in around a sort of a population health, 15 million people in the United Kingdom, in England, have at least one long-term condition, with the prevalence of for example, particular cancers, chronic kidney disease or CKD rising or increasing more quickly. And as works has been documented by the Department of Health retrospectively from 2012 in around this. So initiatives such as integrated care pathways, patient-centered care, and shared decision making are examples of attempts to align clinical, managerial, or service user intrigues to improve coordination of care for patients and those with particular long-term conditions. A concern about fragmentation typically focuses on lack of service coordination for individual patients, and particularly the structural and cultural isolation of generalists from specialist medicine or adult care, and around adult care from healthcare, in context of healthcare, which often results in patients experiencing discontinuity of care when they are transferred from hospital to from home to hospital, or vice versa. And the UK and in the United Kingdom, the healthcare system can't afford to ignore the evidence. And there's works by De Silva, sort of retrospectively 2011 in around this. And a direct quote from works published in works by Shaw and team for 2011, highlight the following, and the following is a direct quotation. Integrated care is a term that reflects a concern to improve patient experience and achieve greater efficiency and value from health delivery systems. The aim is to address fragmentation in patient services and enable better coordinated and more continuous care, frequently for an aging population which has an increasing incidence of chronic disease. So subsequently, in around information and communication technology, or ICT, and shared decision making. So already the sort of 30% of the population with LTs account for around 70% of National Health Service spending. reducing people's dependence on health professionals and increasing a sense of control and well-being is perhaps a more intelligent and effective way of working of a more effective way of working. And there are sort of a broad range of initiatives to support self-management, uh, uh, including information leaflets, online peer support, one-to-one counseling, group education sessions, use of social media with technology, and self-management interventions. Initiatives can be categorized along a continuum where passive information provision about people's condition and sort of the technical skills at the one end and initiatives that are most actively seeking to support and increase self-efficacy at the other end of the continuum. The use of ICT and shared decision making is important for most patients because they want to be more involved in than they want to be more involved than in me than are want to be more involved in decision making about healthcare. And there's works by Coulter and Collins sort of retrospectively from 2011 in around this. There is also compelling evidence that patients who are active participants in managing sort of health and healthcare have better outcomes than patients who are passive recipients of care. The use of user-friendly ICT services is also important for knowledge and resource acquisition and for integrated care. User-friendly ICT services allow the delivery of better understanding, enhancing care quality efficiency across care providers, and to enable better patient outcomes. There's works by Giles from 2012 in around this. All the different types of support or aspects of integrated care are important components of the shared decision making jigsaw needed to encourage self-care, but information provision alone is unlikely to be sufficient to motivate and improve outcomes. So in around this, the use of social media initiatives. So in particular, social media usage has grown exponentially with social media sites such as Facebook, Twitter, Instagram, and others now representing sort of 20%, 20% of time online, and much more in younger people. There's works by Nissan Wire from 2013 and around this. And not surprisingly, patients and carers seek peer-to-peer support via social media which offers advantages over standard forms of sort of interplay with sort of accessibility, immediacy, and offers opportunity for patient for service user healthcare, etc. There's works by Tamimi from 2012 and Ji from 2009 retrospectively and around this. A number of mechanisms to help individuals take a greater care, take a greater entry in own health have been developed, and these include public health initiatives aimed at changing sort of changing interventions such as shared decision making and co-production to increase the number of healthcare decisions made jointly by patients and professionals. There's works by Hibbard and Gilbert from 2014 in around this. And it is important to recognize that patients and sort of service users have 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 very different motivations and capacities to play a bigger part in the design of the delivery of care. There have been a number of attempts to capture this by segmenting patients or service users according to different sort of dimensions. So, for example, the Department of Health in in the United Kingdom developed bases that divide patients into, for example, thrivers, and survivors. Patients with chronic conditions also vary in skills, knowledge, and confidence to approach healthcare. So the aims and sort of the aims and objectives of this sort of overview, and this sort of works was thus. So this sort of research, or this works, seeks to understand seeks to ascertain the understanding and interplay of healthcare service users between social media platforms, patients, and health professionals from minority backgrounds in context of CKD. In addition, this research seeks to explore and understand if and whether it is advantageous to involve AHPs, allied health professionals, in online consultations and or educational sessions between two kidney social media platforms, and to improve health literacy and lives of patients suffering with CKD. The objectives in around this as well are where the research seeks to evaluate educational support for CKD patients, thus those are in the pediatric and adult populations, and overall highlight a critical analyses and dimensions of mentoring surrounding involvement aligned to healthcare for CKD patients before, for example, clinical appointments with clinical appointments with health professionals, and seek to identify whether it is helpful in context of mentoring to, for example, have follow-up online consultations as part of routine appointments. Now, in around this, in around sort of the in around sort of aims and objectives, there is some there are there's some basis in around the methodology around this. So this investigation is novel in that it seeks to use sort of both traditional and contemporary modes to recruit service users and service providers or participants, and to support sort of data collection. A research facilitator would seek to implement or use topic guides to effectively involve participants, providing background of research to fulfill inclusion and exclusion criteria, so thus to help inform the sequence of activities. The justification for using and specifically utilizing a qualitative methodology design is that it tends to help answer multifaceted questions. Similarly, methodologies have also been used. Similar methodologies have been used to help answer questions relating or regarding to healthcare education. The research thus seeks to bring together service users and service providers, researchers, academics, and health professionals from various ethnicities. There are several retrospective works that have highlighted the use of using, for example, online methodologies to collect research data, and in online with this sort of with this overview, there is a sort of a descriptive in around some of the resources in this context as well. In around the sort of recruitment aspect of this works, for service users, for service providers, and for service providers from the perspective of from the basis of allied health professionals and for service providers from the perspective of clinicians from an adult renal or kidney care population and the same from a pediatric kidney care population will be sought to be recruited or involved to collect data in around this works. An informed consent will be sought to would be sought to involve to would be sought for would be sought for participant involvement and outline the particulars surrounding this research. Clear information about the investigation would be made, and privacy and confidentiality sought to be protected. In around the methodology, the research interviews to collect qualitative data to take place at would be sought to for qualitative data collection at several time points. For example, at time baseline zero, at time at 4 months, time at 8 months, time at 12 months, and time at 18 months at 18 months. Implementing quantitative methodology and semi-structured questions in context of one-to-one face-to-face interviews and one-to-one online interviews surrounding themes in around healthcare and inclusion in context of kidney care or renal care would be important to understand sort of dimensions in around mentoring and educational support and to encourage integrated care. Following a one-to-one semi-structured interviews, thematic analysis would be sought to derive themes regarding two strategies in around this works. Software would be utilized to help derive themes and support to derive themes in around the sort of analysis and around the analysis aspects of this works. Analysis from expertise will from expertise would also help assess and evaluate the data or data collection, and analysis would also help understand interplay surrounding research and seek to evaluate educational support for CKD patients, both pediatric or young, those pediatric or young patients or service users, and adults. An overall highlight a sort of critical analysis and dimensions in around mentoring surrounding involvement aligned to healthcare for CKD patients before clinical appointments and health and with health professionals, and seek to identify whether it is helpful in context of mentoring to have follow up consultations as part of routine kidney care appointments. In around sort of the sort of ethical considerations and storage of data, the ethics of doing this form of research is often overlooked and is the first thing that and is one of the first things that needs to be addressed to protect the study participants and guarantee credibility. There has been sort of concern that ethical oversight risks undermining the credibility of participant-led research and fails to protect participants. Guidance will be taken from or sought from works by Vayina and Tasiulas from 2013. An ethics application would sought to be to be derived and highlighting all aspects of this as sort of anticipated works. Information sheets and consent forms would be produced to inform potential participants the intentions and outcomes of the investigation. Taking ethics and storage of any data into further consideration, a social media expert within the team would also sort to advise on how best to how best to ensure that the investigation is an investigation that is that can be can be managed accordingly. Any participant data would be collected. Any participant data collected would be housed would be based on would be linked would be secure would be securely based on a server with firewall protection. In around sort of the specific aims and specific outcomes of this works. So the specific aims are thus willingness of participants to participate and feel included in healthcare and research, understand what our care model is required to support those in chronic kidney disease or long-term conditions in context of diversity and inclusion. Uh, um, uh, and to develop an understanding of how health professionals and service providers, service users can work together to produce solutions for patients with long-term conditions. To understand how mentoring and educational support in CKD is important to ensure there is a learning between service users, service providers across critical topics surrounding kidney care, and highlight sort of healthcare and inclusion in context of kidney care would be important to understand dimensions of mentoring and educational support, and to encourage integrated care. In around the specific outcomes are thus this works or this research seeks to understand how patients and professionals from racially minoritized backgrounds experience healthcare, to understand challenges and opportunities, and what helps and what hinders collaboration. Secondly, the research would seek to evaluate educational support for CKD patients, both pediatrics or young people and adults, and overall highlight critical analysis and dimensions of mentoring surrounding involvement aligned to healthcare for CKD patients before clinical appointments and with professionals, service providers, and seek to identify whether it be helpful in context of mentoring in context of mentoring to have follow-up online consultations as part of routine kidney care, and at the same time conducting a retrospective pilot descriptive analysis of topics and educational efforts between two online social media platforms. This research will seek to understand what healthcare education requirements need to be met for CKD patients. And finally, in around specific outcomes, the research would seek to understand the importance of involving both patients, allied health professionals or AHPs in online consultations and or educational visits online to integrate healthcare practices, and understand if it would be advantageous to have follow-up online or remote educational consultations with a multidisciplinary team or MDT as part of routine nephrology. This draws this audio podcast. This audio podcast aligned to this intermission. This has been an audio podcast aligned to the Traadax Fissure. This has been a Traadax Rupture, and this has been an intermission aligned to a Charlotte edition, and a Traadax Rupture aligned to another evidence-based perspective. Finally, this works again. There will be a list. There will be a list of resources that will be on online for any listeners who want to sort of check out look to check out some of the literature in around this works. Thank you for tuning in, and hopefully this has been of intrigue. Thank you.